Hello everyone, welcome back to Summarize and Memorize. But this is on a new disease, black fungus. As we really felt a need to spread the correct information about what is black fungus, how it is related to COVID-19, who are more prone of this disease, what are its symptoms, and how can we prevent ourselves. And last and the most important question, is this contagious or can this spread from one person to another? So let's first see what is plaque fungus. So plaque fungus or mucormycosis, which is a biological term of it, is a serious but rare fungal infection caused by a group of mold called mucormycetes. These mold live throughout the environment, and this is the bad part of it, particularly in soil and in decaying organic matter such as leaf, composite pile, or rotten wood. Mucormycosis mainly affect people who have health problem or take medicine that lowers the body's ability to fight germ and sickness. It most commonly affects the sinuses or the lungs after inhaling fungal spore from the air. It can also occur on the skin after a cut, burn, or other type of skin injury. So basically, this fungus can grow either on your skin or on your sinuses, which is a nose part, or in lungs or in brain. So it depends, right? Now let's see how it is related to COVID-19. So in normal course, our body immune system successfully fights such fungal infection. However, the COVID-19 affects our immune system. The treatment of COVID-19 patient involve intake of drug which suppress our immune system response. So due to these factors, COVID-19 patients face a renewed risk of failing the battle against this dangerous black fungus. In addition, COVID patients undergoing oxygen therapy in ICU, जहाँ पे humidifier is used, are prone to fungal infection because of the exposure to moisture, as moisture is one of the favorable conditions to grow the fungus. So the chances of recovery from this deadly disease depend upon early diagnosis and the treatment. Now let's talk about who get this mucormycosis or who are more prone of it. Like not everyone gets it as this is rare fungal disease. So the patient who are diabetic or the cancer patient or the patients who have recent organ transplant or stem cell transplant or someone who have lower number of white blood cell or someone who have used corticosteroid use, injection drug use, which is the case in this corona patient, or someone who have too much of iron in the body, someone who has skin injury due to surgery, burns or wounds, and who have low birth weight or who is premature. All these kind of people are more prone of this disease. Baki, this is not general, this is rare. Now, let's talk about the symptom. So, symptoms of this black fungus depend where in the body the fungus is growing, whether it's in sinuses or the brain part, lungs, skin, or gastrointestinal. Gastrointestinal is a digestive food chain with the small intestine and the large intestine. Now, let's talk about each symptom in detail. So, if fungus is growing at sinuses or the brain part, one can feel facial swelling at one side. They can have headache. They can have nasal or sinuses congestion. Or there can be black lesions on the nasal bridge, that black dot on the nose, or upper side of a mouth that can quickly become more severe. And yeah, fever will be there as your body will be fighting from it. Now, if someone has a lungs affected from this fungus, then he or she can have fever, cough, chest pain, or shortness of breath. If someone has this fungus on skin, then there will be blisters or ulcer. These are like chale or that, jo aa jata hai because of allergies and all. And the infected area may turn black. Other symptoms of the skin black fungus include pain, warmth, excessive redness, or swelling around a wound. Now, what are the symptoms of gastrointestinal mucormycosis? Obviously, you will have abdominal pain. you will have nausea and vomiting, and there can be a gastrointestinal bleeding. Now, let's talk about how we can prevent from this disease. As we now know that this black fungus is in the environment, so protect yourself from the environment. So try to avoid the area which have lot of dust, like construction site, and if you can't avoid, just wear the N95 face mask. Avoid the direct contact with the water damaged building. Please keep this in mind that to grow the fungus, water or moisture is one of the important factor. So keep yourself away from water damaged building. There are high chances that it has black fungus. Okay. So avoid activity that involves close contact to soil or dust, such as yard work or gardening. And this is really a sad part, because in this quarantine time many people spend most of the time in their garden and everywhere. But yeah, now you have to avoid such things, and even if you want to do it, just cover yourself completely by cloth. So wear shoes, long pant and a long sleeve shirt during outdoor activity, and obviously wear gloves while handling materials such as soil or the manure. Now, this was the main and the key point to to prevent yourself from this black fungus. But if you are at a higher risk, for example, if you have an organ transplant now recently, then ask your healthcare provider to give you the medication for to prevent other mold infection and this black fungus. Now, the most important question, क्या ये disease contagious है? क्या ये एक इंसान से दूसरे इंसान में फैलेगी? So answer is no, and thankfully no. Like thankfully, okay? So that's all for it. I hope you get all of the questions which you had for this topic, black fungus. Spread this video to more and more people to to make them safe and aware about this disease. And yeah, subscribe our channel for more fun, knowledgeable and educational video. Have an amazing day.